My name is, yes, hi. My name is Nikisha Barbie. I'm a community outreach specialist from Sage Health, and I do see a few familiar faces this morning. Thank you guys so much for inviting us and allowing me this platform again to talk about health care. I brought a few of my market partners with me to talk to you about other services in the community and to talk about one of the most important things for our seniors, and that is Medicare. And I'm going to give a short spiel about SAGE, and then I'm going to move over so my sister can come up, and then Miss Tanya can come up and tell you about these good things that's happening about our 2025 Medicare rollout, okay? So just to introduce Sage Health, um, our CEO, John Haskell, a little bit about us is one day he had to put his dad in the hospital, right? And the hospital he placed his dad in was not really taking great care of him. He was just in the hospital. He had people coming back and forth, no one writing down his information. He had professionals coming in and out, and no one was there to really take accountability for his health. So he was failing. And at one point, the pharmacy had overdosed him in his medication. So that was a huge issue. And we get crazy when things happen to our family in the hospital when we put our trust in them, right? So he said, you know something? This is unacceptable. And one thing I want to do, he said, I want to make sure no senior have to go through this ever again in life. So what he did in 2022 is he built Sage Health. And who is Sage Health? Sage Health is a primary care physicians clinic that offers value-based care. And when I say value-based care, that means we're going to take extra special care of our seniors in the community. We're going to give you more time than the regular time that they give you at our other clinics, right? So he said, you know something? At my clinic at Sage Health, I'm going to give them a whole hour with my doctor for that first appointment. So your first appointment at Sage Health is a full hour instead of the regular 15 to 20 minutes with your regular doctor, because you know something? 15 minutes is not enough time for me to even tell you about my family. I'm sorry, or one condition. So he said, no, we're going to give a full hour because we need to know who you are. We need to know where you come from and what you've been going through. And then you need to find out who our doctors are. You need to build that rapport with your doctor, right? So after that, each of our locations, and let me go back. Sage Health, we are located in 3 locations. That is North Little Rock, and in Bryant. So each of our locations are only bringing in 400 patients, and that's how we can give good value-based care to our patients, because we don't want to have a doctor that's having 1,500 patients or 2,000 patients. That is no way you can give good care and you have that many patients. So each of our doctors, our physicians are only bringing in 400 patients per clinic. So other than the first day you see your doctor, that's a whole hour to see our doctor. And then he said, you know something? Transportation has been a huge issue for our seniors. You know something? We got family out there, but family ain't always there for us. They're not always there. So we're going to offer free transportation at no cost to you to our facility for your appointments. And then we're going to send you out to your specialists in the community on us. We're going to Uber you there, or we're going to lift you there, because we know that's a huge barrier that's keeping some of our seniors from coming to their appointments. Then we're going to offer telehealth. We want to make sure you come to that first appointment, get your assessments done, get everything taken care of. You don't, if you have to be, if you're bedridden and you can't get out, you know something, we'll call you on your phone. We'll provide telehealth. And we also provide home health services as well. So we're going to give you a whole concierge of services at no charge to you at our facility. So once you're enrolled with Sage Health, you're going to have your own primary physician. You're going to have your own nurse practitioner. You're going to have a care coordinator. And I'm going to go back and tell you what our care coordinator do. And you're going to have a COS, and you're going to have a patient experience associate that works on your behalf to help you keep up with your appointments and plan those transportations for you. Now let's go back to our care coordinator. So when you come in that first appointment, you're going to go through assessments. They're going to take your EKGs, your blood tests, labs, all of that good stuff. And we're also a preventative clinic as well. So we're going to run tests to help prevent Alzheimer's, to help try to catch dementia and things like that as such. And we're going to also take you through an assessment to make sure your whole social environment is okay. Because that's one thing that we have problems with. If our money ain't looking right, we ain't trying to go to no doctor and we ain't trying to buy no medication. How about this? We want to take all of that anxiety off of you so you can maintain your health with Sage Health. So we're going to ask you things like, how's your home? Do you have transportation to where you need to go? Do you have groceries in your house? Do you need utilities paid? That's what our care coordinator is there for, because we want to make sure there's nothing that's going to prevent you from getting good care at our community. So on top of getting good health care, getting value-based health care, we also do fun things like partner with great partnerships in the community. And I'm going to bring my sister up so she can talk about some of the things she does there. So we like to bring a lot of resources in our facility. So we have different things in our facility that seniors can do, like bingo. We do senior fit classes. We do Tai Chi classes. We do sip and paints every week. We have happy birthday parties, and we bring market partners in to talk about different things that our seniors normally won't be able to get. And we also partner with brokers like Miss Tanya to talk about those important things like that Medicare. Because you know something, I read through a lot of Medicare plans, and listen, if it wasn't for my brokers, I wouldn't understand nothing going on. I wouldn't understand a thing. So we're happy to be able to reach out to all of our partners and get resources. And we like to provide a safe place for our seniors to come in and get those resources every month. And also, if you would like to take a tour to see what Sage Health is all about and what we have to offer, you can always give me a call, come up there, take a tour, talk to our doctors, talk to our nurses, talk to us, and see if it'll be a good fit for you. Get yourself a $15 gift card in any place you like, just to come up there and see if it'll be a good fit. I know sometimes you say, I've been with my doctor so long, you got that loyalty and everything, but sometimes them doctors not doing what they're supposed to do. So loyalty goes out of the door when you're not doing what you're supposed to do with my health. So if you're not married to your doctor or your physician, come on over to Sage Health and let's see if we'll be a good fit for you, okay? And after the presentation today, you can always come back to your back and we can talk more about Sage Health. So I'm going to introduce one of our market partners, my sister, to talk about what she does, and then we'll have Miss Bell to come up and talk about the new plans with Medicare, okay? Thank you so much.
That's my sister. Nikisha Barbie, Sage Health. Good morning. Good morning. Today is a beautiful day. Just because it's raining doesn't mean it's beautiful. I always say that's God's way of slowing us down sometimes. Because sometimes I need to be slowed down because I'm at 100 all the time. But I love what I do. And that's actually really just being resourceful for the community. Because there are a lot of things out there, that's why I love, who I work with, because we take our job seriously. Our job is to make sure that our community knows what is out there to be offered for your health, for your mental health, your physical, your spiritual, and for your household, food, anything. I'm just not up here talking about Timber Ridge this morning. I'm talking about anything. I try to be resourceful. I try to educate myself so I can pass it on to the next person. But this morning, we're going to talk about Timber Ridge. So Timber Ridge is neurorestorative. It is a post-acute rehab located in the Ouachita Mountains, right in Benton. It is basically, we specialize in traumatic brain injury, spinal cord injury, and it just slipped my mind. It really did. But we'll just go ahead and just keep going. And behaviors in kids. So I know a lot of people don't think of kids coming into like a post-acute rehab, but yes, ma'am. So a lot of kids are born with things like RADS or with alcohol syndrome. Those things cause behaviors as they grow up. those behaviors are not going anywhere because it's a part of who they are. So what that rehab does, what we do is we teach children how to cope with those behaviors and what to do. And with that, that is what is specialized to each individual child. We pretty much take that child in, go through all of their medical records because we have a host of therapists, doctors, nurses, certified teaching techs is what we call them. They have 2 per child. 2. That is every day. It is an inpatient treatment program that we gear towards our peds and our adolescents. For our adults, that's traumatic brain injury, spinal cord injury. So you don't have to be coming straight from the hospital to come into the program. Say you went to short-term rehab, went home, it's still not going right for you. That's what we're there for. That's what we're there for. We're going to bring you in, we're going to look over your records, and we're going to specialize your treatment plan specifically for you so we can get you back to being independent. That is what we're there for. Now, we sit on 340 acres. There's a workshop, a pool, a greenhouse, an orchard. So rehab is pretty much like you're at home. Those daily things that you do at home, that's what we're rehabbing you on, because that's where we're trying to get you back to. We're not a facility. We're a residential program. It's ranch style. It's not hospital walls. You don't walk around in these blank walls. No, you're going to come up on a ranch sitting on acres. And when I say beautiful, you're going to be in God's creation. You're going to see trees. You're going to see 1,000 squirrels, probably 5,000 deer. You're going to see all of what God has created to create that mental space for you to be at peace, because that is the beginning of rehab, is your mental. So I'm going to leave information here. My card is going to be in the back also. Just reach out, give me a call if you know of anyone who is coming out of the hospital that's looking for a rehab, anyone who's been at home, anyone with any child that, hey, let me see if I can go and see if there is anything else going on with this child other than just regularly just behaviors. But there's always something that a doctor may miss that we probably can look and see, okay, maybe something is neurological going on. So just give me a call. Again, my name is Marcy and it's Timber Ridge. Thank you. And again, I'm going to hand it over to my sister.
Thank you, Marcy. All right, all right. So we're back to what everybody came for. So I'm going to introduce a person who's been out here in the trenches with me, out in the streets, highways, and byways, getting good health care to our seniors. I call my seniors my babies. So I only deal with brokers that I trust, that are going to give great health care and going to give the right plans. And if you don't have to change a plan, I know for sure that she will not change your plan in order for you to go a certain place. So I'm going to go ahead and introduce Miss Tanya. Miss Tanya Bell, one of the best brokers out here in this side of Little Rock. Okay. All right. Come on up, Miss Tanya.
Good morning. Good morning, everybody. So, wow, what a wonderful way of introducing me. I guess I got to stand up to that. So again, my name is LaTanya Bell, and I am licensed. I don't like to call myself a licensed agent. I like to call myself an insurance or Medicare guide. What I want to definitely do for you is guide you to where you should be. Okay. Some of you are already there, but we don't know until we go through the gist of getting there. Okay. So if we get in our car and say we're going to go to Little Rock, I don't know if you're going to make it until I get in there with you, or you call me and tell me that you're there. Okay. That's what I'm here for. I write for 8 in Arkansas. I write for 8 different companies. Now I'm going to name them. Humana WellCare, let me think, United Healthcare, Devoted, Cigna, Blue Cross Blue Shield. I always miss one. Aetna, thank you. And it's somebody else. Ambetter State. I'm getting ready to write for them. But pretty much every company here, I think if I didn't say Cigna, I have a lot of stuff from Cigna. Humana is huge in Pulaski County. Cigna, Humana, United Health, and Aetna is huge in Pulaski County. And what I basically want to do is talk with you to see where you are. It's not just about your insurance, just like before me. You have to get to know the individual. So there are different challenges that each individual has. Some of them may include transportation. I know that in the city, that transportation isn't as much of an issue as it is in the rural area where I typically am. But transportation, we want to talk to you about some other different things that maybe I like to talk to people about current stuff. So a lot of the plans, pretty much all of the plans declined. So for 2024, the people that were already with me, one of the things I did around August, because I started being able to tell that there was going to be a decline in those insurance plans, is whatever you have today, use it. So even though it's November, whatever you have on your plan this year for 24, it's not too late. Go ahead and make that appointment, because for 25, those are going to decline. Your dental is going to decline for the most part. If you need a hearing aid, you're probably going to pay for it. This year, well, 24's plan, they did give you more benefits and allowances, but for next year, they're going to go down. Your medicine is going to go up. And I talked to an interesting party, and they said to me, because my question was, I always get aggravated with medicine, because I think that the government should pay more for our seniors with the prescriptions. They have the money, so I'm thinking, why should the seniors see that? However, they claim that it kind of plays a part, just like when you play the market. The medicines get, especially these Ozempics and Mounjaros, those are going through the roof, because people that don't have to have them for diabetes are using them. So they become a hot commodity. And those particular drugs, I have some clients that are paying $1,000 for them, but they're not diabetics. They're doing it for weight purposes. So I say to you, I don't ask people anymore, if you want to check to see where you are. I say to people, you need to check. If you've ever been concerned about your health, you need to check to see where you are. Now, what's going to happen next year is your insurance company is going to place you on a plan that's close to where you are. If you are not on a chronic plan, you really need to be concerned, because they're just going to they have all of these new plans. If you're on a chronic plan, there aren't a lot of new chronic plans. So you're probably going to be what we consider safe, but if you are on anything other than that, you may not be. The best thing to do is not assume, but to find out for sure where you're going to be. Yes, ma'am. So what's happening, CMS, which is the Center of Medicare and Medicaid Services, they brought in brand new rules. They haven't done that in about 20 years. They're telling me, because I haven't been in this business for 20 years, but they're saying it's been over 20 years. So if you've been on your plan for at least 4 years, 3 to 4 years, all of the insurance companies that are out here, they had to completely change what they were doing. So there's changes to everything. That's why there's such a decline in the allowances that you have. So what they're doing is, or what a lot of them did is, the plans that have been out there, they've chosen to get rid of them because there were just too many changes that they needed to make, and they brought in brand new plans. United Healthcare has 5. Now, they're the largest company that has the most plans right now. Humana, I think, has 2. Aetna has 2. Cigna has 2. Blue Cross Blue Shield has 3. So there were so many changes, they didn't want to go through and nitpick on each plan. So what they decided is, okay, we're just going to X that plan out and start fresh. And they have a lot of plans for 2025 that are going to have a Part B give back. Now, most of those are for veterans. From 24 back, when they started implementing veteran plans, the only people that got money back were veterans because they already have coverage and they wanted to buy into the veterans. So they wanted to give them something, they would give them money. It's not much, but a lot of the plans, it goes from 30 cents to about 125 bucks. Okay. It depends on what you want to do. So that's why I said it's important. If you're looking at next year, now we don't know what's going to happen, of course, but if you're looking and you're planning ahead and saying, I want to do my dental work this year. So then you need to be looking at, let's say transportation is an issue, you should go to Sage. But if transportation or whatever that issue is, if you're looking to do dental, then you need a plan that hits on dental, right? You don't want a plan that has a high, you get a lot of benefits from vision and you don't wear glasses. It has to make sense for you, so that's the point behind this whole thing, is the reason why I'm telling people you need to look at your plan. You need to shop. And the reason why is because if you've been on your plan for 3 or 4 years, if nothing has changed, you should stay. There's no reason to move because your plan is there. Nothing has changed. You haven't declined, had any changes or anything like that. So you should stay. But if you have had any differences in your health and you've been on that plan for 3, 4, 5 years, that plan may not be the best plan for you. That plan may not help you like you need it today as you did 5, 10, 15 years. I've seen some seniors that have been on their plan for 20 years. Now, how do you regulate that plan is the plan you should be on today if it worked for you 20 years ago? Yes, ma'am. You did get notified. You should have been notified. Those letters should have come out between September and October 1st. Well, this is what I say to people, because I've had people, by law, they were supposed to have notified you. Now, your letter could have gotten lost in the mail. I don't know. But my clients, I got an email that said that there was a change. Or it will say, I know when I look in the system, it will tell me this person's plan is being upgraded or it's being renewed. And it'll tell me about what that plan should look like. But that's the thing. You need to make that decision. I can't make that decision for you. I'm not you. Whoever, the company that you're with, they can't make that decision for you. It's not for them to make that decision. But if you don't make the decision, they have to do something. So in their mind, they're doing a service for you. Okay. But I'm saying you need to look, your circumstances. You need to look and decide if this does work for me. And if it doesn't, then you have a right to make a decision to do something different. Okay. Definitely. If you got notification and you disagree, whether you did or you did not get, or you didn't see the notification that there was going to be something different, definitely reach out to me or someone that you trust so that they can, and it has to be someone who can see several plans. I've talked to people and they say, well, I was told by a young lady or a young man that this plan was the best plan for me, or this plan worked out best for me. But then you need to ask the question, are they only able to see one plan or 2 plans? Because if I only sold 1 or 2 plans, well, yeah, that's the best in the system that I see because I only see 2. But I'm with all of them. Not all of them. I'm with everybody but 2, and they're smaller companies. So I just say, do yourself a service. It takes about 15 to 20 minutes, depending on the meds that you have, in order for us to check. If you have your Medicare card, I need to know who your doctors are. There's no way for me to give you accurate information if you only give me 2 doctors and you have 10. You have to tell me who they are because I need to see if they're in the system with that company, okay? And then I need to know what drugs you take, what prescription drugs, because we need to look at the cost, because the cost is all over the table. So if I can't get access to that information, then I can't give you a true answer, okay? And definitely I'll have some cards out there. The cards that I actually have is from one carrier because I did not have to pay for those cards. It gets very expensive when you're buying. I think I can get 100 cards for about $68 and then costs about $6 to deliver. So about $75. And so, but that doesn't have anything to do with who all I work with. So if there's any questions for me, I try to be everywhere. But again, my name is LaTanya Bell, and I'm 870-589-0788, and I do have cards on the side. And thank you so very much for allowing me. Yes, ma'am. Yes, ma'am. I am available to do assessments today. It doesn't take but about 15 minutes. I say 15 to 30. Like I said, it just depends on, have to do homework, but yes, ma'am. So, well, there's a lot of changes because with everybody, your benefits have lessened. And then it depends on if you're on a chronic plan or if you're on a regular PPO, or it depends on if you're on an HMO. So it's hard for me to give all of the changes just in a verbal, blanket. But every single company has lessened their benefits. And the biggest reason why they're saying that they've lessened is because of the rule of CMS. There are a lot of people that pay over $600 a month for meds. This year, they have what they call a payment plan for you. That's a plan where they take your meds. Someone should have called by now. They were supposed to be signing people up around well, it's not the 15th of November, but they were supposed to start calling the 1st of November. If you pay $500 to $600 and over for meds, they're going to be trying to adopt with you this payment plan, and it'll stretch it out over 12 months so that you don't have to pay $500 or $600. You start out paying somewhere around $166 for it. I think that's a travesty for seniors to pay $500 and $600, but that's a different conversation.
What they call $2,000, you're already into major medical as far as
that is true. So, okay, so next year for 2025, they have a $2,000 payout. Okay, that's supposed to be the max that you have to pay for your medicine. So I'm going to say that that's the rule. I'll get myself in trouble. That's the rule. Then you have some insurance companies, depending on who they are, that has a deductible, which is what you will pay before insurance will start to pay. And that goes from 200 up to 2,000. Okay. So pay attention, because if your insurance has not kicked in, that $2,000 hasn't started. That's how I'm going to leave that. Your insurance has not kicked in, then the $2,000 isn't a part of it yet. So if your insurance company is ABC and CMS has set a rule to say 2,000, okay, that no one will go over 2,000, but your deductible is 2,000, which means that's what you pay before the insurance will pay, then there's 2,000. And then CMS has said $2,000 for the meds. Well, the insurance hasn't kicked in yet. So there's 2,000, and then the rule of 2,000 for CMS. Yeah. Deductible is before insurance. Before insurance comes in. Yeah, so CMS has made a rule for 25. No one should go over 2,000. Okay. But that's with your insurance. Okay. But if you have a deductible, that's before insurance. Deductibles are paid before insurance. So if you go to the doctor and you have a deductible of $50, you're going to pay $50. Let's say your medicine is $65. You got to pay $50. Then the insurance kicks in and pays the $15. Does that make sense? Okay. Does that make sense?
yeah.
Okay. Okay, yes, ma'am. Okay, so that's a different scenario. They are working or have worked. Now, I don't know exactly the cost. I talked to a lady yesterday and she was told by her pharmacist, and then, so that goes into a totally different, okay, because you have insurance, you have pharmacies that are considered standard and preferred, okay? So standard are the mom and pop type places most of the time. They don't fall in the category of preferred because they're gonna charge you a little more because they're not a Walmart or a Walgreens. They need you to pay 60 bucks because it's just one store, they have bills, okay? But Walmart may give you their own discount because they're a large company. You know, they get billions and billions of people that come out. So that's really important when you're looking at your Medicare. If you tell me that you go to Walgreens and I plug in the system that you're going to Walgreens, it'll say it's preferred or it's standard. If it's preferred, I'm going to tell you, well, they want you to go to Walgreens because you're going to get your best benefit. If you go to Daddy-O's Pharmacy Tech, I don't know, it may not be. So your meds at Walgreens may be 40 bucks. And if you go to Daddy-O's, it's 65 bucks, okay? You make your choice where you're going to go. Now, if you're with United Healthcare, for instance, they have their own pharmacy company, which is at home, they mail it out. If you go with them, they are gonna say they're preferred. They have a contract with that pharmacist, and they're going to give you the biggest bang for your money. Okay. If you're with if you're with WellCare, if you're with Aetna, they have their own companies that they partnered with to give you a good benefit. Okay. And they want you to do that. A lot of people don't like doing it because it does take a couple days before you get your meds. But even when you do that, don't forget, you can always ask your doctor for, do you have any samples? A lot of the time they'll have 4 or 5 that they can not give you, but, they'll work out something where, you may have to pay $1, or something like that, just until you get those meds in the mail. We forget about those things when we don't use them often. If you have medicine that's expensive, you can go to the manufacturer and you can say to them, do you have coupons? I have a lot of people that I call the manufacturers for. You can't forget those things. They have them to give out. It's sad that the doctors sometimes don't tell you that, that those things are out there, but that's why you should have a good agent too, because so the coupon is a coupon. Yeah, you get it off if I bring you a coupon and it's, it says 40 bucks off or 90 bucks off, you're not paying the 90. So you can't have it with your, you can't file it on insurance because you're not paying it. Sometimes it'll say, you'll pay $5, if you buy this, 10, you get, a month supply or something like that. Yeah. Yes, ma'am. Mm-hmm.
Once you pay your deductible, you don't have a deductible every time you go to a.
No, ma'am.
Pay a deductible, like my deductible is $650. Once I pay $650.
That's it.
Down.
Yes, so deductible is before insurance kicks in. Copay is, like you're helping to pay for the meds, okay? And then you have coinsurance. So coinsurance is like a contract that says anytime you use, you may pay 2%, 1%. There are not a lot of coinsurances, with the Medicare Advantage plans, but there are a lot of copays. Okay, so they've negotiated a contract with that individual and with the insurance company that says you'll pay a portion. And they've derived that to say it's going to be $5 instead of a percentage, or $10 or $30. Did that make sense with that? Okay. So thank you again for allowing me to speak to you. Look, I love what I do. I don't have any of my grandparents, so I make y'all my grandparents. I do, and I love the advice. I love how you talk to me. Look, come here, girl, or that's her. You know, look, all of that. It's just something about helping people. I've always kind of been, the last 10, 15 years, I've always kind of been in that arena. I was thinking about the training before. I'm not crazy about kids. That's personal. Love older people. It is shame on me, but I'm very truthful about that because I don't want nobody to put me in a classroom with kids. But I love older people. Oh my God, love y'all. Love y'all, love y'all, love y'all. And y'all love back. That's what I really get into. So I appreciate your time. If there's anything that I can do for you, I'm here, and God bless you. Yes, ma'am. That's enough. See it right there. Ma'am. So every year there is going to be an increase. There has been anyway, an increase. It's typically not much. So this year was $1 more than last year. So that's not horrible unless you have some sort of a penalty. So if for some reason you denied your enrollment into Medicare when you were first eligible, which means at 65, most people that are eligible for Medicare younger than that, they don't deny it. They don't deny it because it's a health thing. So they don't deny it. But if when you turn 65, you said, most people that I find that go into that are veterans because they already have coverage. But if for some reason you didn't know, I don't know what the circumstance may be, and you decide, I'm not going to do it, and then you find out that you're penalized, then it'll be more. I do have a couple people that are paying in the 200s. How much? I should talk to your son. I shouldn't be that high though. But yeah, so, you know, everybody's circumstance situation is different. That's why I tell people too, I've had, I think, and I know it's not meant, but what we try to do is help our neighbor to say, well, I'm with a plan and it's so great for me. And oh my gosh, it's doing all of these wonderful things. But if your health situation is different from hers, it may not be great for her. It may be the worst thing she's ever seen. And then she gets upset with you. So you really need to have an individual that can see for her. The best thing for you to do is to tell them you need to talk to somebody. If you are not happy, you need to talk to somebody. And so you are able to get the help that you need, not the help that your sister got or your cousin. Yeah, because that doesn't mean anything. It just depends on your circumstance. Yes, ma'am. No, please. No. Okay.
Right.
Mhm.
Feel free to change out.
When you say TRICARE, so you're not talking about the veterans TRICARE. You are. So veterans are on a different timetable. If you are a veteran and you are going to a veteran plan, you don't have the same stipulations as everybody else. Okay. If you are not a veteran, you do. Don't miss out because you're only going to have one chance next year. Prior, you had every 3 months, every quarter, you could look at doing something. That's all gone for next year. No, the ability to move is all gone next year. They're not doing that. So when January comes and you decide you don't like whatever, you get one shot. That's it. That's another reason why we're trying to, I'm telling people to pay attention because you don't want to get with the wrong person and then you're stuck until October next year. Yeah, so yeah, they can. But you're not gonna, so AEP is October 15th to December 7th. Well, you're not gonna have that plan until January, okay? So most people are telling me they typically don't go to the doctor till the end of January. I don't know why they wait till, I mean, I guess you just don't need it, or maybe it's the weather, I don't know. But so then you're looking at maybe February, finding out. I mean, if you go to the doctor in January, how long does it take to get a bill? 20 days, 15 days? I don't know. Okay. So then mid-February, you're looking at, now you know if you're unhappy with it or not, but you have until March to decide. If you don't like something, you can look at doing something different. But then after that, you're done. So you need to get, ma'am. Yes, ma'am. October. Unless you create, well, then here it gets, now we're gonna get tricky. You're stuck. I typically just say you're stuck. Unless you create what they call a SEP, which is a reason to move. If there's a major storm and you get relocated, you move out of the state, something like that, okay? You get Medicaid or you lose Medicaid. If there's a major change, you create what they call an SEP, which is a reason for you to change, okay? Because now you have a circumstance, or let's say you're okay today and you develop diabetes. I hope that doesn't happen for anybody, something, or you have a heart attack. That creates a reason for you to have a plan that you couldn't have gotten prior. So that creates a reason for you to change. And you have 30 days. Okay. 30 days. I know it gets complex. I try not to get into all that because in the last couple things you say, that's what people remember. Yes, ma'am. Couldn't see him. Yeah. The company.
Anytime I call stage now, we can get you in, just, we can walk in. Just walk in, anytime I call my doctor's appointment, they give me their next hour.
Okay. That's a testament. Okay.
She always said walk in, but now it's different.
Okay.
Everything is totally changing, but that's why I want to do that. So I know when I've been building United Healthcare with Medicaid, commercial.
Cigna too. Okay. Okay. Yeah, Cigna. Okay. You do. Okay, well, good. Okay. So I wanted to just bring, so Miss Barbie and I were just kind of conversing and saying that with Sage, they do partner and they accept any other plans that kind of coincide and made that relationship, partnered up with TRICARE. So you would feel comfortable going into their clinic if you have, and I keep looking at, I'm so sorry. I'm not picking on you though. Okay. Well, I'm just saying that because I keep thinking about veterans and I see your hat. So that's why I keep kind of staring at you. But what's so important about, well, not just this year, like I said, there's just so many changes that are going on. And me being in this industry now where I deal with seniors, it's like everybody targets the senior population, and unfairly so, in my opinion. But what I have learned with dealing with this profession that I've chosen, y'all are not, what word do I want to use? Like y'all are some really sharp people. No, I don't, not majorly. So what I found is, I don't know how to say this without this sound. Well, you don't, but like you guys are sharp. When I'm talking to the seniors one-on-one, y'all are on top of it. But for some reason, I don't know where it has come from, like, but a lot of the seniors that I've come in contact with, in a group setting, in a big group setting, they just don't speak up. And I don't know what that derives from, but when I'm talking to them one-on-one, and I love that. If I'm telling you something that you disagree with me. You're the person that, you know, I'm trying to impress or whatever. Disagree with me. This is important. You know, I tell seniors, if you go to the doctor and your doctor says, if I'm your doctor and I say, I'm going to put you on you know, and you say, well, what is that? Well, you have this illness and, you know, you just take these 3 pills. Exactly. Make it make sense to me. And then they'll say, well, you know, just like Miss Barbie said, well, you know, you only have 15 minutes in the doctor's office anyway. The doctors now will tell you, well, if you have problems with you came in here for your shoulder. If you have problems with your knee, you need to make another appointment. Well, I'm here. Yeah, but I got 4 people. Well, that's not my problem because you got 4 people, you know, and I just remembered, you know, because it's raining today that my knee has just really been aching. Come on, y'all are the most important people that I've seen. Right. Y'all are the most important people that I've seen. And you have to make people listen to you. You have to speak. You have to talk up. If there's an illness, if there's an ailment, whatever it is, have people, they're trying to get your dollar. You need to make them stop and pay attention to you. You're important. And don't just sit on the sideline. You're important. And you should know that you're important. And so if there's an issue, just like what Ms. Barbie said at Sage, they make you a priority. That's what you want. That's what you need. That's what you deserve as an individual. Not to just have somebody push you on through the line. No, you've been here, you've done whatever it is in your life, you've made it thus far. And it's not just by pushing you through the line. So stand up and make sure that you get the attention that you deserve. That's important. And only you can make them do that. You should be. You're a priority. Okay. That's true. That's true. And it is, I mean, so it just depends on where your heart, where your thoughts, what type of individual, meaning, you know, physician that you are. I mean, they give us all metrics. They give me metrics. At the end of the day, I have to sleep at night. There are certain things that I'm going to do that they're not going to allow me to do, or not that they're not going to allow me to do, but there's a metrics. In order for the company to be successful by their metrics, they give you a plan of action. So sometimes I do use that as a guide, but sometimes I have to go away from it because at the end of the day, I have to sleep well at night. So they tell us you should be done in 18 minutes. Okay, well, you know, sometimes it works, sometimes it doesn't work. If you don't have any meds, just like this morning, there was a gentleman saying he knew someone that was 79, and they took only a high blood pressure pill. Well, that appointment takes 10 minutes, long enough for me to write your name and address and your doctor. You know, you got just a PCP. You don't have any specialists if you're not taking anything. And then I need to look that up for you by your address. But if you take 10 pills, from the pharmacist. That takes a little longer because now there's more work to do. If you need transportation, if if you're having an ailment or, you got a specific doctor that may be a big issue because not all clinics, not all insurance companies take all doctors. So there's a little work for me to do, in that. And I just ask people, give me a few minutes because I need to put all this data and get an answer for you, you know. Anything else? Okay. Thank you again. I really appreciate you. Thank you so much.
Okay, thank you so much, Tanya. Thank you so much. So this will wrap up our session. Please, you guys, feel free to go and get an individual assessment. This Medicare is something serious. You'll enroll in something, and then down the line, you go to the hospital and find out you got a bill that you didn't think you got. You should have, okay? So it's very important to assess what you have every year. Get with a broker, get with a trusted broker to make sure you're on the great plan that's going to be beneficial to what your health needs are. Okay. We want to thank you guys so much again for this platform. The rain did prohibit a whole lot of other people from coming out, but we will come back out if you guys would like for us to get more good information out. But I definitely want to thank you for allowing us this platform. Thank my sister for coming out talking about Timber Ridge. She's here if you guys want more information about Timber Ridge. I'm here if you want more information about Sage, and Tanya is here if you want to go and provide an assessment for your Medicare Advantage or your Medicare plan. Thank you guys again. Oh, yes, and we have some good eatery over here too from Chick-fil-A, so feel free to go up there and grab what you like, okay? Thank you guys so much again.